we don't really have, that I know of, a pedigreed calculation of what the right amount to spend on healthcare is. We know a couple of things. One is that the American healthcare spend is way out of line with other developed nations. I mean, frankly, just about double what OECD countries are spending on healthcare without anything like better results. In fact, we're ranked pretty low in outcomes, in longevity, in the satisfaction of our public with its healthcare. So we're spending too much in America. I'm pretty convinced. I personally have kind of put a stake in the ground here that, gee, we're at about almost 18% of our gross domestic product. I see no reason at all why we couldn't have all the healthcare we want and need without a hint of rationing with, say, 15% of gross domestic product. That's still 3% more than probably the next most expensive nation. So that's been my target idea. There's one other really important idea here which is relevant to AF4Q, and by the way, relevant to Robert Wood Johnson's successor focus on a culture of health, which is if you look nation by nation, not just at healthcare spend, where we are really excessive, but at the total spend on healthcare and social supports and the investments in affecting determinants of health, housing, transportation, child support, education. If you look at the total spend of health and social care, social services, we're about the same across the developed democracies. The difference in the United States is not that we're spending more total, it's that of the total, so much more is healthcare and so much less is working on determinants of health. And I personally think Robert Wood Johnson Foundation has gone exactly where it needs to go now, focusing on that, saying we need it's a rebalancing job. So there's aligning forces for quality, but there's also rebalancing investments for health. And I think that's really where the action needs to be.